Thank you.
Thank you. Assalamu alaikum to all of you, and hi and greetings to all the viewers here. I am from Jamia Hamdard University, New Delhi, India, and I am very much honored to present my presentation here. And I should thank the organizers for providing me this opportunity to speak on scope of Unani medicine in this COVID-19. And I'm here to share my presentation here. And since oh, there's some problem. And uh, so hope, am I audible to all of you? Can I give an, okay. And this way I want to actually, I have been given only 10 minutes to present my talk. I am Dr. Azhar Jabi, and I am actually Unani physician. And my presentation will be on scope of Unani system of medicine in COVID-19. And this is my university. I should now come to Unani system of medicine, and there have been earlier presentations on this system actually by the different name, by Iranian or Persian medicine. Unani system of medicine, it is also called as Greco-Arab and Persian medicine because of it is like the development was in Arab and Persia. In India, this system thrived and is integrated into national healthcare system and officially named as Unani medicine. Now, the modes of Unani treatment. Let me first of all discuss the modes. There are three modes usually in Unani system. One is non-pharmacological mode, what we call as ilaj with tadbir and dietotherapy. And then there is pharmacotherapy and then surgery. The basic principles of managing infection or managing any disease in Unani system of medicine. Is my presentation visual? Is it?
Yes, ma'am.
Okay, thank you.
Thank you.
The basic principles in Unani system of medicine is like to destroy the causative organism, which we called as sabab ka izala, and then to improve body self-defense mechanism to combat that disease. And for this, we potentiate and stimulate the power of self-preservance, the tabiyat, which I will be explaining in next slide. And our this approach when we treat this disease, our approach is holistic as well as individualistic. Holistic means taking consideration of whole the body with the surroundings and the environment in which the patient is living. And also individualistic approach is like we have to take into consideration of mizaj and akhlaq, that is temperament of the body, organ system, disease, as well as the drug that we have to give to the patient. And the focus is on potentiating and stimulating the power, this tabiyat power, self preservation, so that body can itself fight against the invaders or prevent it from these toxic invasions. The concept of immunity in Unani medicine, there is it's very vast, and focus is always remains on the basic, actually the immunity or quwwati mudafa and quwwati mudabbara of the batan. These are the defense systems within the body to protect the host from the invading pathogens. And quwwati mudabbara is the power of self preservation or adjustment, which strives to restore normal physiological functions within state of individual, and its ability to neutralize and eliminate the pathogen microorganisms and their toxic products, thus providing protection to the individual. In Unani system of treatment, great reliance is placed on this power, the aim of physician being to help and develop rather than supersede or impede the action of this power. The health state is believed to be based on sophisticated fine maintenance and control of immunoregulatory mechanism, and this is governed by the power of self-preservation. And one of the therapeutic strategies in Unani medicine is also to increase body's natural resistance and helping Quwwat Mudabbara to restore the normal health rather than directly neutralizing the agent itself. This is achieved by using various drugs mentioned as tonics or mukaviyat in Unani classical literature. And the main clinical objective of immunostimulants is prophylaxis against the opportunistic infections. Now, immunostimulant drugs are those which enhance the body's immunity and enable the body's resistance power more efficient in order to prevent the body from various kinds of infections, immunodeficiency diseases. Now, as far as concept of infectious disease and epidemics is concerned in Unani system, it has been already, I think, earlier presentations have given about, have elaborated this. In Unani system, it's known as Waba, and it is thought to occur through Ajsame Khabisa. It is evident that despite the inability to observe microbes, Unani scholars could envision and comprehend their sources and reservoirs, modes of transmission of infection, and potential causes of infection turning into epidemics. Their, their theories and observations closely resemble the contemporary knowledge of infection, which reinforce the fact that Unani medicine can play a significant role in combating current health problems. And you can see they were well aware about the transmission, about the tadia, huma, and about the incubation period, quarantine, and also I won't go into detail since time is short. And let me come to this prevention. As far as prevention of any disease, viral disease or infectious disease is concerned, or any epidemic is concerned, we know that uh, Avicenna was the first to use 40 days isolation. And this was known as quarantine, and it was adapted by Vietnamian merchants as and European ones through their world wars and during epidemics. The preventive measures for epidemic disease are collectively aimed towards the importance of immunity, prevention of spread of infection, hygiene and antiseptic measures, and promotion of general health. Host defenses are given particular importance, and according to Razi, people who come physically active and exercise regularly have a less susceptibility to epidemic diseases. Patients having a weak constitution and those suffering from underlying disease are said to be more susceptible during epidemics. The basic measures advised is to avoid places where an epidemic is spread. In case it's not avoidable, then a person advised to stay at well-ventilated place, preferably distant from the ground. When interacting with the patient, care should be taken that the air currents may not be directed from a patient to the healthy person. And during epidemics, it's also advised to avoid unnecessary physical exertion. Now, immense stress is placed on purification and sanitization of surroundings during epidemics. And Unani physicians employed medical herbs and as decoctions and distillates to spray or as fumigants to keep the air free of contaminants. And homes should be sprayed with diluted vinegar to keep the air clean. And according to Zakaria Razi, some aromatic drugs can destroy infectious agents and should be used as fumigants during epidemics like ambar, loban, sandrus, and other that I have mentioned here. Since these contain volatile oils with biologically active substances such as alcohol, terpenes, which may provide air purifying effects on fumigation, but much of potential is yet to be proved through clinical trials. And you can see on screen the herbs that I have written here, they are used as fumigants. And more emphasis is given on dietary modifications. Unani physicians were aware of the immunomodulatory effect of citrus fruits. Besides, other measures of health promotion during epidemics include having a wholesome diet, avoiding starvation, avoiding meat and fish, and staying hydrated. And it was recommended that scungibine may be advised to patients for during the epidemics and for the prevention as well as during as a treatment. This is a mixture of honey, water, and vinegar that is boiled in a syrup form, and then archiglob is added to it, and it is being advised to be taken during this epidemics. Now, health, as far as health protecting drugs measures, they need a special mention here. And certain drugs have also been prescribed for the purpose of health promotion, like Revancini, Gulibnafsha, Halela, Amalta, Sturanjibine, Abi Anar, vinegar. Vinegar may also be taken orally as part of diet or salad, etc. And Ibn Rushd has given a description of medicine, which he made a curious claim, like whosoever has used this formulation during one epidemic remained protected from it. It was Sibr, which is aloe vera, murmuki, Commiphora muki, myrrh, and each one part, and saffron, 2 parts. This formulation was actually has been advised, and it has been recommended by different renowned Unani physicians. Now, here I am actually presenting some of the what we call as immunostimulants. These are some drugs, single drugs, which have been found through studies that they have an anti-inflammatory property, they are antioxidants, and they are again immunostimulants as well. So Unani therapy has a very powerful role to play in the prevention of different viral diseases by immunostimulant property, or they have antiviral property. These may also enhance the bioavailability of modern chemotherapy to maintain their sensitivity and overcome the resistance. And for this reason, such immunomodulators or such immunostimulants are being given. I mean, they are given for the prevention as well as for the treatment of the infections, and they can be prescribed in this COVID-19 infection as an add-on therapy. And the Unani pharmacopoeia drugs that are known, that are I have presented here, that are known to possess immunomodulatory properties and generally by.
Please 2 minutes. Please 2 minutes.
Okay, fine. Thank you. And these are actually the immunostimulants. Let me come to this. These are some Unani compounds that we prescribe, like Khamira abrasion, Khamira gauzaban, Khamira. They are all, and studies have been done that they augment the self-resistance, strengthening the vital organs of the body. They can be prescribed in this COVID-19 as an adjuvant, as for preventive as well as for therapeutic use. And then let me come to possible approach to prevention and management of COVID-19. And for these, let me say, we have to deal with for preventive as well as the for therapeutic use. The drugs can be given in decoction form, that is behdana, unnab, sapistan, and khaksi, because this COVID, the symptoms of the COVID resemble very much to one epidemic waba that we called as nazla wabai. And since the symptoms resemble upper respiratory tract infection, upper respiratory symptoms are more prominent in this case. And this is the drug of choice in Unani system of medicine, Bihidana, Unnab, Sapista, and Khaksi. That in this dosage form, they are given in decoction form. And then if there is diarrhea, Habbal As and Tabashir can be given. And for relieving thirst, Shire Tukhme Kahu, that is Lactusa stiva, it can be given. And for the application, local application on chest, Karuti Arad Karsna, with aloe vera and Croctus sativus, that is saffron. They can be crushed, mixed, and warmed slightly. Then they can be applied on the chest and covered with the cotton bandage. Now this is my last slide where I will brief the entire recommendations from Unani system of medicine in COVID-19. We have here, you can see the list of drugs, immune enhancers. They are all immunomodulators. They have antiviral, anti-inflammatory, antiviral effect, and antioxidants. They have been, and some of them are very prominent. This is a combination that can be given as a preventive as well as therapeutic, and it can be given with an add-on therapy to the modern medicines that are prescribed in COVID-19, with the antiviral therapies if available. And then we have here for respiratory infections. These are the classical medicines that are recommended, and that all these have been time tested, and there have been studies done on these all these in various respiratory diseases, and these have been found to be to act as the good expectorants. They are bronchodilators, and these are actually the bronchodilators, anti-allergics, as well as immunostimulants, and plus they rejuvenate the lung tissues. That has been studied experimentally, that the drugs like, for example, Aslasus and Odusa and Banafsha and Unnab, and Kata, they have been proved, I mean, experimentally, not clinically, that they rejuvenate the lung tissues. And for goggles, we have an formulation here, that is Cassia fistula, Maltas, Tooth, Morus nigra, and all these. These can be used as goggles, and these goggles can be actually, they can be given, they can be done daily before sleep. And this is the fumigation, that is Lobon, Sandrus, and so this slide that I am giving here, I mean, what you view here in this slide, this is actually that can be that can help in COVID patients, since we have not carried any clinical trial yet to make sure that these are really helpful. But I have seen in previous slides the people have used all these, the ingredients of these medicines have already been used in Iran for the treatment of COVID-19 patients. So I can say, since these are time tested and they are free of side effects, these are our pharmacopoeial formulations. These formulations can be used in COVID-19 pandemics in this thing. And sorry for taking much time, and thank you. If any question, you are free to ask. Thank you very much. Thank you.
Thank you for your nice presentation.
Thank you very much.
Thank you. You're welcome. Okay, Mr. Grivas.
Can I leave? Or
Yes,
I have
yes.
to? Can I leave? Thank you.
Yes,
Thank
yes,
you very
yes.
much.
Thank you, thank you. Okay, next presentation is next presenter is Konstantinos Grivas from Greece.
Hello to everybody. Just a minute to share the screen, I think.
Yes, very good.
I think you have a picture now.